Well, hello and welcome to all of our viewers from around the world. I'm Fiona Langsharp, IBCLC Director of Communications and MC here at Gold Learning. Well, welcome to all of you joining us here today. Coming up, I'm going to be talking about our Gold Learning Birth and Beyond Symposium 2022. I have to say, this is one of my favorites. All things birthy, as you can imagine. If you know me well enough, you know that, I was immersed fully in that field for a very long time before becoming an educator. And so now I get to meet up with some fantastic people who are also educating the world. And I have to say that getting to know Mandy Irby has been my pleasure. And we also got to meet up just recently, but we'll chat more about that in just a moment. But welcome to you, Mandy. It's so good to have you here.
Thanks, Fiona. It's good to be here and see you again.
Yeah, absolutely. So Mandy, you and I, when we first started researching your name and looking into you and our education planning team, we were so excited to see you online. And, do you remember that first meeting that we had? We had it online. Do you remember that?
Yeah, I do remember it. We talked for a
Yeah.
while.
Yeah, it was a little while ago, but I tell you, there was this sort of getting to know each other. Were we the right fit? And I love that so much about you. It just spoke volumes to me because it's how I conduct my life, really, with my clients, with folks online. And you and I, we just spent some time together and sort of getting to know, was this really going to be the right fit? Were we going to come together? And I feel that this is your whole character. I feel like this is who you are at the essence. So thank you for taking the time to do that. Do you do that with everyone that you meet, Mandy?
Um, uh, I don't know about everyone. That's a little, I grilled you. So I don't think I grill everyone. Usually it takes a little longer and I ask a few questions here and there, but I hope that folks do it with me too, because I think that the quiet stuff doesn't need to be left unsaid anymore. We should be able to talk about,
Yeah.
how we're conducting business and who we're going to be speaking next to and what kind of equitable access there is for your platform and for your audience and your speakers.
Yeah, absolutely. Absolutely. And I know that was some of the really important questions that you had for us here at Gold Learning. And of course, I was excited to have someone that was, pushing hard to find out those answers and share them with you. I was thinking about the whole premise too, that, when we're in this world conducting business, whether it be through education or with our families, informed decision-making seems to be such an important value, particularly for me and you today. And I know you probably have some feelings about those things. Are you seeing folks sort of being driven by, in both parameters, education and family as well?
Oh, for sure. Informed decision-making, I think, speaks to both audiences that I try to reach in the birth space. I try to reach the professionals at the bedside and also the parents kind of at the same time, because they're kind of learning about informed decision-making together, honestly.
Mm-hmm.
We think that we know about informed choice and informed consent and informed decision-making as professionals at the bedside, but I think that we often miss the mark. And it's helpful for parents to hear that language as well, because it's exciting for them to be able to envision, making decisions for themselves about their birth, which is kind of a new concept in the US around birth culture.
Yeah, absolutely. Well, I think, in many Western cultures and cultures in general, we hear this from our professionals around the world. So I know that you're speaking to the right audience here in terms of, sharing that information and those folks wanting to do better where they are as well. Okay, well, let's wind things back a little bit. Let's get you to introduce yourself perhaps and share a little bit about where you are in the world and, what does your life look like these days? Tell us a little bit about it.
Sure. My name is Mandy Irby, and I'm a labor and delivery nurse, and I am in Southwest Virginia right now. So I'm on the East Coast, and I live kind of in the mountains. I live in a valley. I have two children, and when I think about where I live, we often talk about how lucky we get to live in such a beautiful place, how lucky we are. So we have the mountains outside, and as you can see, I'm not at the bedside. This is my home office. And this is where I work now since the beginning of 2020. I left labor and delivery after about 12 plus years. And I did what uh, new nurses are told not to do. And I went directly into my specialty, and I loved it so much.
Mm.
I loved it so much that I knew that I could affect birth culture and affect more nurses and affect more families if I was not at the bedside. So I made that tough decision to leave, and now I teach parents and nurses, mostly professionals and parents, full time from my home office while my kids are in school.
Oh, fantastic. Well, yes, you're probably one of the brave people out there, when it sounds like that's part of maybe your character though. No judgment here. It just sounds like you love to jump in, you know exactly what you want to do, and you just take a hold of it, Mandy.
It is not that cut and dry. I have a lot of insecurities about it. In fact, I just did a piece for I forget which journal or which kind of online magazine it was, but they listed me as former labor and delivery nurse, and I was like, oh, ouch. Is that
Oh,
what I'm not a former labor and delivery nurse.
right.
So I just keep saying I'm a labor and delivery nurse,
Sure.
but not at the bedside, which I believe allows me to open up for creativity in ways that I wasn't able to do at the bedside, because I do
Hmm.
believe that nursing it's really sticky, and working for a hospital is really tough, and it hinders creativity and it hinders our voices as nurses. So I had to step away.
Well, your voice is certainly appreciated in education. I know there's many people that invite you to speak. I feel like we're very fortunate to have you here at Gold Learning. I know your schedule is busy. This topic you're going to be sharing on, I'm just going to read the title for folks so that they know what you're going to be taking on here. So Trauma-Informed Care, a guide to patient advocacy for trauma survivors. So to me, that rings bells right away. We're hearing a lot about, trauma-informed care. I think that, sometimes there is that essence of that makes me feel kind of uncomfortable too, Mandy, and I'm like, what is that going to entail? Is it going to be hard? Hard things are hard, right?
Mhm.
But yet there is a responsibility in me as well. I think there's a responsibility in our communities. And so I just wanted to express some of the emotion that, just in reading the title, that it comes up for me. So tell me, I know that this is a topic that you appreciate, you've studied, you advocate for, but tell me why, because this also feels, you talked about hard things at the bedside, in real time, but this feels hard too. So first of all, tell me a little bit about why you want to share about this, and then we'll maybe talk a little bit about what's going to be in the presentation.
Sure. I really appreciate your honesty about what that title means. And I know we've workshopped that title a lot, and it it does evoke emotion, and it does evoke uncomfortable feelings for me too.
Hmm.
So we're just sitting in that together, and it is not easy work. I have the cliche story of being a nurse and then having a baby, and then my world was rocked.
Mm,
And I had to make a decision. It was an awful, what I considered at the time to be an awful experience. And I sat a long time with those feelings, a really long time with those feelings of, if this is the best that it can be, if I have
hmm.
so much privilege inside of the place that I work and the people that
Sure.
I know and the birth that I know about, what am I doing as a labor nurse? How could my patients possibly have a better experience? I had to really look inside myself. And then I looked around, and all of the passionate birth professionals around me were feeling the same way. They're doing their best. They're doing their best. But I was kind of there to say that just wasn't enough. And it is a lifelong memory that we keep and a story that we share. And it actually kind of resonates throughout our whole community, are the birth experiences that we have as a community and a culture.
Mm,
So I went on that uncomfortable mission of figuring out, how are we going to do this without hurting people accidentally,
right.
and came up with trauma informed care is is kind of what it's called. It's a buzzword right now, but in trauma-informed care education, we have to be trauma-informed in our discussions and in our presentations. So we try to make it's an uncomfortable topic because it's a very much looking inside ourselves and asking ourselves questions, but I don't want it to be intimidating to do because
Mhm.
we're kind of doing it together and it's uncomfortable and it's
Yeah.
a journey.
Yeah, that's true. And I think that's the key thing is that we really are in this together. That sense of responsibility, I think when you're a birth worker, you work in birth, that's just something you have. I think that's why some of us get into it is that we feel a sense of responsibility. We care so much. We are natural advocates, even if we don't spend our lifetime in advocacy, but that is kind of the core, the foundation, I feel. And, you know, I was just out of birth just less than 2 weeks ago. And it was a stark reminder of why I do what I do, why I'm in education, why I still advocate. But it also reminds me reading your title, reading the abstract for your presentation. I can't just skim the surface on this, Mandy. I have to do the hard work. And as much as it kind of doesn't feel right, it comforts me that I have people like you, to lean into and you to lead the way and say, yes, this is going to be hard, Fiona, but you're going to be okay. You'll get through it and you will feel better on the other side because you'll feel like you're actually accomplishing the work that you set out to do. So that's how I read into it. And so I appreciate you for, again, sort of paving the way and being gentle while you do it. I know that you have such a huge heart for this and appreciate, just the essence of your hard work in order to give the tools and the education to all of us who are still here, working hard at it. So thank you again. Your work is so much appreciated.
Thank you. You said it really well. It is work that is hard, but it's worth it because it's a true learning of what advocacy is.
Mm-hmm.
And it's kind of like we all got into the birth care profession to be advocates, but then we've been what I believe is a bit misdirected in what advocacy is
Right.
and what patient-centered care is. And so it kind of feels like we're aligned
Mm-hmm.
again when we learn this and we learn, oh my gosh, this is what I've wanted to do. This is what I went into it for. I've just been searching for this feel-good feeling in my practice. And I think
Mm-hmm.
that is what learning about advocacy is and what trauma-informed care is. So it does feel good, but it
Yeah.
gets gritty. It's
Yeah.
okay. We're all doing
That's
it.
okay. We can handle it. We can
We
do it.
We can't. It's not
And
like we're
that's
not
what,
in gritty
yeah.
right now. We're gritty's everywhere. We're
Yeah.
going
Yeah.
with a goal.
Yeah, exactly. Well, that's why we do what we do here at Gold and, loving this Birth and Beyond Symposium so much. And I know that, we cast a wide net here too with our conference. It reaches many people, who work, prenatal right through to postpartum. And I know that, this is just one of our topics that we're going to have over 2 days, but boy, it's going to be great, Mandy. I'm so excited that you're going to be with us. So thank you so much for joining me here today. It's been so good chatting with you.
Thanks, Fiona. I can't wait for a few more weeks, and I'm excited to see what the 2-day conference holds.
Yeah, absolutely. Absolutely. That's awesome. And again, for all of you listening in right now, this is your opportunity. Early bird is still in effect for this event. So head on over to goldlearning.com right now, and you can just pop in the search bar, Birth and Beyond Online Symposium 2022. It is going to be set on days October 17th and 18th for most folks. So of course, around the world, slightly different time zones. Check out all the details. You'll see the live event is scheduled. However, if you can't make the times, don't forget, everything will be recorded and you'll be able to come back and join us at your convenience. And we have our exclusive forums where you'll still get to ask Mandy questions and all of our presenters are there. So all the things, as we like to do here at Gold Learning. Well, thank you so much to Mandy Irby for joining us here today. And we'll look forward to seeing all of you online. Have a wonderful rest of your day, everyone. Bye-bye, everyone.